I was very curious to see how things are here.
Being in Bangalore, we made you taste filter coffee.
Yeah.
Filter coffee is like our all-time favorite here.
When we arrived at the new airport, it was like, wow, this is amazing.
After I joined HCG, it's about 13-14 years now. So we have completely changed the chemotherapy protocol because the children have got a very highest survival rate. So how is it in Netherlands, your care? Is it completely nationalized healthcare, or how is it? I've seen more than 8,000 bone tumors so far. It's quite a big number. Imagine the whole India.
Yeah.
Is this the first time in India for you?
Yeah, first time.
I never knew the Sarcoma streamlined 40 years back. That's very good. It's very good.
Yeah.
101st case got
infection.
Hi everybody. This is Dr. Edwin Dierselhuis. So he's essentially orthopedic oncosurgeon from Radboud UMC, Nijmegen.
Yes, correct.
The Netherlands. A good friend of mine. We studied together in Rizzoli in Bologna University about 13 years back. And since then we have been interacting with each other with orthopedic oncology and socially other things in various conferences. And we met in the last MSOS in London. I happened to invite him to Bangalore, to our center. So he has gracefully agreed and he's with us. Thank you for coming, Edwin.
Yes.
Thanks a lot. Very honored to have you here and pleased to have you here. I'll allow Edwin to introduce himself about your place and your job, your place, and yourself personally.
Yeah. Well, thank you, Dr. Pramod. So first of all, a lot of thanks for inviting me over. I still remember London 2022 very well, that you say, come to my place, I'll show you. And I said, okay, let's do it. So I'm very glad to be here.
Yeah.
Had a very good stay, so thanks a lot for that. And I'm an orthopedic oncologist, as you said, in the Radboud UMC hospital in the Netherlands. It's one of the 4 centers that treats bone sarcomas, and I treat only tumor patients, both benign and primary bone tumors and bone metastasis. So from that background, I was very curious to see how things are here and how everything is going. So good to be here.
Good. And we're very happy to receive your wife and son along with you. I'm sure they're back home now.
Yeah, they went back home a few days ago. So they have been here for like a week.
Yeah.
And especially for my son, who's 7 years old, it was quite an experience. Yeah. Because back in the Netherlands, it's quite quiet. So for him, it was a whole new world. So very overwhelming, but also very enthusiastic about it. People in the hotel took very good care of him and my wife. So they enjoyed to stay here very much. So both they could go some places to see around, but also have like a relaxed vacation time here while I was at the hospital. So that was good, very good for them.
Is this the first time in India for you?
Yeah, first time. So I was introduced to India by other people, and but you have to experience for yourself. You really can't tell how it will be. So some family of mine had already been here, but like 20 years ago. So times have changed. But it was a very good experience. And actually, when we arrived at the new airport, it was like, wow, this is amazing. This is such a nice place, and we were very warmly welcomed by your colleagues.
You like the new airport?
Nice.
Bangalore new airport. It's beautiful, right?
Very nice. All the bamboo you see, and it's very nice.
It's ecologically one of the best, I think, green airports now.
Yeah, I can imagine. Yeah, it was really surprising that it was like, but I understood that it was there for a few months.
It's very new.
So I came in the right time.
That's nice to have you there. Right now, many people read internet, Instagram, social media, Facebooks, about any place you go first, Google. Yeah. So was it syncing with your research and the real picture? Yeah, I didn't Google it that much upfront because I wanted to have the experience like with an open mind. I wouldn't have too much fixed ideas already in my head. Correct. But I expected that, like when I looked up for your
yellow ribbon page, all the things like that, and the things you are doing with the 3D planning and all things like that. So for me, it was like, okay, in the hospital, it would be like meeting first world and third world, where they come together, because like patients come from all over the country, have very delayed diagnosis, things like that we wouldn't see in the Netherlands, because if there's a bump, there will be at the general practitioner within a week. So that's very different kind of population. But that is what I had expected, and I think that's up to some degree that is still true. I found out. Yeah.
So now, as you have brought up this situation, this is the most pain point for me every time. So I've been talking with various people about it. Particularly when you say a bump in a child, let's get some of the statistics straight for our viewers, because many people are still feel that the cancer or a bone cancer in a child itself is like the kind of an end stage or something like that. It's not like that. No. So what's the overall cure rates, or I would say people who live a normal life?
Yeah, well, I think about 70 to 80% overall survival, depending on the subtype, of course, and the whole treatment. But that outcome is very much determined by the correct diagnosis, correct steps, full chemotherapy treatment, the right irradiation if needed, the right surgery. So if things are done in the right way, step by step, then you can have a very good outcome. Not only about survival, but also in functional way.
Yeah. What we come across right now, as you have seen so many cases during your visit here, like let it be an outpatient department or even when we are operating, the one thing I'm sure is stacking at you is we see a more complex cases.
Yeah.
Is it right?
Yeah, so more complex cases because like there has been previous surgery before that's not done by an expert in the field. Or like a very long time of referral. So people only come after years instead of months or weeks. But that's dependent on the patient. You have not much control about that. But I think you can control to say the people who are allowed to do this kind of treatment. So in the Netherlands, sarcoma care has been centralized about 40 years ago for bone tumors. So we have very strict referral patterns. Only a few hoops resections even now and then, but that mostly counts for the soft tissues. But especially for bone tumors, that is very rare. Although there's one thing that in pathological fractures, especially in some older population, like 50s or 60s, there tends to be still people who just treat it like a normal fracture, and then they found out that it's a chondrosarcoma or osteosarcoma. So that's a slight lack of awareness, but I think that should raise to another level even here. So
So for the sake of viewers, I'll summarize what we come to a point. The outcome of bone tumors or bone cancers in children is as high as 70 to 80%, provided it's referred or it's treated correctly from beginning. Right treatment, first time, without much delay. So that's the thing. So most of the time in our perspectives, the things happen, one because of the awareness issues, and number two mainly because of the financial issues. There are a lot of viewers who are from the government perspective also. So for me, I would strongly recommend, these are all children, and completely the cancer care or cancer things in children particularly has to be completely taken care by the state government or the government, whether it could be, for us it's center or state. So because the children have got a very highest survival rate. So how is it in Netherlands, your care? Is it completely nationalized healthcare, or how is it?
It's not really nationalized, but it's like people have to have private insurance. But for children, that insurance is free. So it's under the insurance of their parents. So in that way, all patients can have the same type of care. And even if there are like people who don't have insurance because they are like a refugee or something like that, and then there are a few hospitals in the Netherlands that are designated by the government that they can have that treatment, and the hospital indirectly financed by the government can take care of the patients as well. So for sure budgets are of importance, but the individual budget is not. So everyone can have the same treatment, has the same access to care, and I think it should be like that.
Yeah. I think that's my important recommendation, because we have so many schemes from various governments, whether it could be central government or state governments, but not even one scheme which covers a standardized care governed by a body, one central body. It cannot be an old body which has been bureaucratically, people who have been running the organization from many years together, and they're going guiding. Updated protocols, updated methodology will give you definitely longer outcomes. Children need national policies or national coverage, particularly financial, to prevent delayed entry to any hospitals. And even the referral centers has to be defined, right?
Yeah.
The referral centers has to be defined for a particular disease, right?
Yeah, so for like sarcoma, it's only a small percentage of total cancer care, but still, if you look at the numbers of the total population, that is still many lives.
Exactly.
So they're as much as important as any other.
1.4 billion population, as you rightly said.
Yeah.
So we have we ourselves are not a huge center, but we have seen more than 8,000 bone tumors so far. It's quite a big number. Imagine the whole India. So definitely there should be a certain referral centers. That way even the training programs can get streamlined. So
and especially also for the treatment programs, because it's not that every orthopedic surgeon should be fully trained to treat oncology, but they should be aware of what they're facing and what should do for the next steps, to the right referrals, not to do biopsy yourself, things like that.
That's very, very true. I never knew the sarcoma was streamlined 40 years back. That's very good. Very good. So now, as we see, the overall survival in oral cancers. So one of the most common myths is, if a tumor or if any cancer spread to the bone, that means it's almost like is lethal. So, but today, in the presence of targeted therapies, immunotherapies, and very precise radiations, very precise surgeries, the long-term outcomes are increasing. Meanwhile, a tumor which is spread to a bone is not an indication that it's a palliation, right? So you have something to say on that?
Yeah, because previously, 20 or 30 years ago, bone meds were like, okay, this is the last stage of life, and we do some radiation or some pain medication, and that's about it. But as you said, because of the increasing overall survival, increasing population, it becomes more and more numerous, and said that about 2/3 of the patient with metastatic disease also develop bone metastasis. And if you look at the US figures, about 20% of all cancer treatment costs is covered by the bony meds. So that's a large impact on patients, on society, but still they are treated like 20 years ago, 30 years ago. So I think also for that we have to have a paradigm shift in that, other way of thinking, other way of organizing things for treating bony metastasis. Not in all cases. Most of them are quite straightforward. But in special cases, then you can do a resection in an oligometastatic disease, or you choose for a prosthesis instead of a nail when you expect long-term survival. Things of that should be a paradigm shift that has to be taken to treat that patient as well.
So now you have seen the facilities, of course, in India now. So we have the technologies, you have come across 3D printing or robotic work, or even the skills of an engineers, or our associated colleagues whom we closely work with. Is there anything lacking compared to the Western world with the terms of it?
Yeah, well, I think if you look hardware terms,
hardware terms,
I think all ingredients are there.
Everything is there.
Yeah, you have the 3D printing stuff. You have CyberKnife. It's all there, but I think it's mainly about organizing. So the organization of care, I think that will be a bigger determination of outcome than all the tiny things you use. It's very nice to have that adjunct, but the organization is most important. Structure, yeah.
So structure is where we are lacking, is what you say. Yes.
Yeah.
Processes and structures.
Yeah, and I can't judge on how things are outside of this hospital. So within your hospital, with the MTB and all the things like that, they are going the correct way, I think. But for the outside world, I think that could be more structured to do right to these patients.
Yes. So essentially, we have all the tech, we have all the people needed, we have all the engineers, doctors, teams. So all it needs is a proper structure ways to make sure our patients live longer and also benefit longer. I mean, it's essentially it's the quality of life for any child. That's what I always look at. A child, after I joined HCG, it's about 13, 14 years now. So we have completely changed the chemotherapy protocol, like the MAP regimen. The chemotherapy itself is not a standard here. So even if I'm sorry to say that only 10% of India may follow MAP regimen. So that's so not right?
Yeah.
So we had to literally struggle it out every day. Now even I struggle it to give a right chemotherapy. So the outcome is almost 70% of those students. They're becoming doctors, they're becoming engineers. So good to see that. So they own their businesses. A patient of mine owns a very big pharmaceutical business now. It's good to see. In initial days, I did not know oncology, medical oncology also.
No.
So I had to, people made me learn that.
But it's like that. And I also think not only the surgical part, but like the irradiation part, the medical oncology part, sarcoma are like a rare subtype. So even also the medical oncologists should be fully trained to treat those patients.
Very focused, right? So let's come to an education perspective. How did you end up becoming an orthopedic oncosurgeon, if I may ask?
That story began actually, I think, about 15 years ago. I was still a medical student and I was doing my rotations. And by accident, I went into a rotation of orthopedics in University Hospital in Groningen, which is also a sarcoma center. And I wanted to be in orthopedics. I was thinking of going into orthopedics. Anyway, and by chance, I also went for that rotation. And I still remember that in that day, we had to write all the cards of the patient and get the whole story and done. So he was there, young guy, just had a child, had finalized his chemo. So I had heard all that story. And the next day there was the operation. We did like a distal femur resection, put in a big prosthesis. And that moment it snapped. It was like so great. He can survive. He can walk out of the hospital with his child in his arms. And like very fascinating surgery. So that moment I was struck by orthopedic oncology. And that's how it began. And a few years later I went to Rizzoli in Bologna, which is a specialized center for that, and there we met. And I went into my residency for orthopedics. For sure, it wasn't sure if I would end up in oncology because there was like very limited positions available in the Netherlands. But by chance, I got into the right position, ended up in Nijmegen, which I'm still working now. I had 1 year of training, fellowship training over there, and I was lucky to stay. So that's how I ended up.
An orthopedic surgeon. So want to pursue as an orthopedic oncology as a career. As a do you feel it's a great it's a great field to enter?
That's it's where I think you have like I think the orthopedic oncologies are like a rare breed. They tend to be some different of normal orthopedic surgeons, but it's very nice, not only because all the things I just said, but mainly because that all patients there are a story. Every patient is different. Every type of surgery is different. And in every case, you have to think about, okay, what is the best solution? What is the best resection? What's the best reconstruction way? And you operate throughout the body. So in that way, it's very interesting, and it's also very for me, it's like a very layered type of job. It's not only about putting the right hip in, which is great, which is very valuable, and I have good colleagues who do that very nice. But for me, that would not be. So I like the layerness of the job you do.
Same here. I think it's as I say, many people come asking for me whether should I join. I said it should be a very long-term play, and it's a very slow play. Like in.
I think in orthopedic oncology you have wouldn't know when I'm an expert actually. So when are you an expert, and when I think you train and train and train all the way through your career. So it's not like, okay, you can do this hip procedure and you will do that 100 times a year or something like that. It's very different. It's very different.
101st case is different.
It
so happened once. We had to present a paper on allografts. So none of the 100 allografts were infected for us. Fortunate, touch wood. Initial 100 allografts were not infected. So when we presented a paper, they literally, how can you not have an infection? 101st case got infection. So yes, thanks for that. And you are here during our one of the most sort of festivals called the Dasara festivals. It's about a 10-day celebration for us. So all went to Mysore also together. So could you please tell what's your experience on during the Dasara festivities, food?
It was very because you told me before that there was like a festivity, but I wasn't really aware of the impact and the meaning for you personally and for your country.
It was very nice to have you.
So it was a good time to come, and also the thought behind all the puja and things like that. So this was really great, and I was really amazed to see all operation instruments are not dressed up, but they're
we do puja for the
so all instruments they had flowers and things on it, so that was very nice. And especially the food, that was also very good. So it wasn't as spicy as I had expected.
So many people ask me, India food is very spicy, so that's the one common question everybody asks. I mean, it's a bit, I think we have as we discussed, Thai food is also
that's much more spicy for me. So so that was very nice.
Being in Bangalore, we made you taste filter coffee. Filter coffee is like our all-time favorite here.
Well, normally I don't drink coffee with milk nor sugar, so it was a little milky and a little sweet. But still, I liked it though. Actually, although if I was allowed to, I could also have a black coffee. But it was also very nice.
Great. Very great to have you, and nice time to have you yesterday. Thank you for joining us for the festival also. It was very good to have many people liked in the event. So please keep coming to Bangalore. Thank you for that. Any other comments you want to add?
Well, to end up, because you invited me over for all the kinds of things that I really appreciate is your hospitality, not only you, but also your colleagues here. They're so welcoming, and I feel like it's genuine. So you really feel embraced. So that's a good thing. That's one thing I will remember for sure.
Please, anytime.
Okay.
Anytime.
Thank you.
Thank you. Thanks, Edwin. Thanks a lot.